In this video, we're going to talk about 8 qualities that will make your medical personal statement stand out. The first thing to really try and understand is that medicine is translational. What do I mean by that? Well, what we mean is that you need to first of all learn the science behind the medical problem, but then we need to apply it to the patient. And some of the most impressive personal statements that we read are the ones where, yes, people have been intrigued by the science, but they've really understood the link between understanding that science, applying that science, and then putting it into clinical practice. So even though medicine is heavily scientific, you need to be able to then put a link to that to patient benefit. So try and emphasize that in anything that you talk about in your personal statement. It's also really important to recognize that practicing medicine, being a doctor, is a privilege. You're going to be present as a doctor in some of the most important points of a patient's life. You will be there at their birth. You'll be there during significant disease processes which will likely change their life forever. And, more than likely, you may be there at a patient's death. You're going to be there when people are at their most vulnerable. You're going to have access to some of the patient's most personal information, things that they wouldn't have told anyone else, including their loved ones. The people that you are going to be dealing with are going to be vulnerable, scared, and have both psychological and physical impacts from the disease that they're suffering from. So, as a doctor, you have to be humble. You have to understand that this is a privilege, and those personal statements that start to allude to that and an understanding of that really go a long way. And it's great to be able to put it into context. So one of the best things you can do is during your work experience, really think about those times that you've seen in your work experience where you've seen patients who are vulnerable, and use those examples in your personal statement to show how doctors and nurses put patients at ease and take the time to be empathetic to their patients. We want to see medical students who understand the privilege of being a doctor. We want to see people who are coming to medical school really have a notion of what it is to be a doctor. And it's more than just being able to learn a lot of science. It's about being able to apply it to a person, a real patient, and being able to do it in an empathetic and kind way. One thing that's really important is medicine is essentially an apprenticeship. From the moment you come into medical school, you are starting a journey that will culminate in you becoming a doctor. But it's really important to understand that being a doctor is not a job. It's not something where you go in at 9 and finish at 5 and then go home. It is a vocation. You will be devoting your life, the rest of your life, to this job. As such, we want to see that people are responsible, that they're not going to be the type of person who come 5 o'clock when when your shift is meant to finish, if there's a patient who's suffering, who's sick, in pain, or dying even, that you don't just turn around and leave. We want to make sure that the medical students who come into medical school are those that really understand that it is more than just a job. We're not just there to play the number of hours that we need to get paid. We're there to look after patients. You have to love the subject of medicine. You have to love the learning about medicine. But you must always be able to take it back to the patient. You must love looking after people, and it really truly does have to be a calling, because there are going to be many times that you're going to come home late because you are looking after patients. Having said that, you need to understand that medicine is so rewarding, and it really has to come across in your personal statement and in the answers to your interview, that it's one of the few jobs that you're going to make direct impact on patients' lives. They're going to be really making a difference to people. The decisions that you make will potentially save a patient's life, or if you make mistakes, potentially you could cause great harm and even death to a patient. So it is a huge responsibility, but when you get it right, you can really make a difference to people. It's also important to note that being a doctor isn't just about prescribing stuff, or if you're a surgeon cutting things out. Sometimes medicine isn't going to cure a patient. And understanding that a huge amount of the rewarding bit of a doctor as a job is the fact that we can be there for people. And often that's all patients want, is someone to be there for the patient, to empathise with them and try to understand what they're going through. Also, as a doctor, one of the most rewarding things is being able to teach juniors, to be able to pass on knowledge, and for those juniors to then go on to use that knowledge to help and cure other patients. It is a great privilege to be a doctor because you really have a huge amount of knowledge that you gain through your mentors, and then you can then pass that on to others. And that is hugely rewarding. Now, during your work experience, it's really important to try, if you can, to speak to other doctors and find out the things that they find rewarding, and try and use those examples either in your personal statement or in your answers to your interview questions. Something that's really important for you to make clear to us in both the personal statement and in your interview questions is that doctors are continuously learning for the rest of their career. For the whole of our careers, we are either doing exams or learning for the benefit of our patients. As such, it's really important that you show in your personal statement that you have got an understanding of that. Try, if you can, in your personal statement to talk about where doctors that you've seen in your work experience have really tried to bring forward their knowledge or showed evidence of teaching others, or that they've gone themselves to conferences and things to try and push forward their knowledge. Also show evidence of where you've tried to do the same, where you've learnt about something in the syllabus for both either A-levels or international baccalaureates and found it fascinating and gone and read around the subject. Show that you've got a voracious appetite for learning new things. One of the best things about medicine is the fact that it's versatile. There are so many specialities and subspecialities, it literally caters for every different personality and interest. So, if you find from your first work experience that it hasn't quite captured your imagination, have a think, talk to the doctors that you're around, and speak to them about the type of person that you are, and they may well be able to recommend you another speciality that might be exactly what you're looking for. It always looks so good on both the personal statement and on interview questioning when people have really taken the time to look at the different specialities and had to think about what suits their personality. You should always try to be inquisitive, and there are ample opportunities to ask questions and to push the boundaries of current scientific knowledge. Always have a look at the latest research that's out there. Look at newspaper articles and journal articles like New Scientist and Scientific American, and try and see whether you can capture the imagination of these things. And you will find that medicine pretty much captures every single one of those things. Even something as esoteric as, for example, nanotechnology. Actually, there are so many applications for medicine. So have a little think about it. Maybe even suggest some of those in the interview to show that you've been thinking around the subjects. It's really important. It's also great as a profession when you've gone through medical school because it opens up so many doors for you. As a doctor, you can work in almost any country. You have a translational set of skills, and you develop an amazing number of personal skills like teamwork, leadership, understanding of scientific method, all things that you can use to do absolutely anything, even if you choose at the end of medical school not to be a doctor. It's not the end of the world. There are other things that we can do. It's also really important to understand that medicine is more than just science. There is a social dimension to it. No two patients are the same, even if they've got the same disease. They have different wants, they have different worries, they have different fears that they have to be addressed and managed. They have different social circumstances that may need to be thought about. One of the best things about medicine is that no one day is the same as the next. So showing that you've got an understanding of that you've seen that either in your work experience or in other aspects is really important. You can also see that medicine is a multidisciplinary job. You are working with multiple different specialities like physios and nurses and dietitians and pharmacists and other doctors in different subspecialties. You are always talking to people. You are always trying to do the very best for your patients by getting as much information as possible from different places. It's really important to understand that, and those personal statements that really highlight that show us that you understand what it is to be a doctor. It's also important to understand that half of medicine is actually dealing with the patient. You can know the answer to every scientific question. You may know exactly what the right treatment for a patient is, but if you can't communicate with the patient and their family appropriately, it doesn't matter because you won't convince them to have the right treatment. Although it seems obvious, it's important to actually also highlight in either your personal statement or in the interview that being a doctor is challenging and that you understand that. Now, it may sound like a bit of a contradiction, but actually, it's one of the best things about the job is that it is difficult. No 2 days are the same. You're always thinking, you're always learning. It's fantastic, but it's also tiring. It's tough. Every day is going to be a challenge, and there are going to be new challenges there. It's really important to understand that your decisions will have significant implications on patients' lives and that you have to do the very best that you can to make the best decisions for those patients. So highlighting the fact that you understand that being a doctor is going to be challenging, but also then highlighting how you, on your work experience and talking to doctors, have seen how we cope with those challenges by talking to other professionals, by getting advice, always learning more and more about your diseases and the things that you're treating. It's so important, and there's no room for complacency. Having those examples to hand either in the personal statement or in the interview questions, again, just shows us that you've thought that little bit further, that you've really thought about putting yourself into the shoes of a doctor. So really try to highlight that you understand that being a doctor is challenging, but you also understand how to cope with those challenges, or at least have seen other people cope with them and be able to explain those coping mechanisms, like talking to other specialities, getting advice, reading things in journals, talking to the patient and actually being honest with them and saying, look, I don't know what the right answer is. Sometimes that can be the easiest and the hardest thing to do for a patient. But it's really important that you show you've got at least an understanding of that. If you can, try and address each of these 8 points, because the more of this you address, the more versatile your application will be, and the more it'll look like you've really got an understanding of what it is to be a doctor and to apply for medical school. If you can, give an example and personalize that example. Use your experience from work experience and also from your personal experience to try and highlight how you've tried to get a better understanding of each of these points, and also what you've seen of other people trying to deal with these things. The more you do of that, the more it'll look like you've actually prepared well to come to medical school, and you'll convince us as admissions tutors that you're the right person for medical school application.